Hello, everyone, and welcome to this episode of the In the Know podcast for patients living in Knowsley. Today, our topic is PPG, or Patient Participation Group. And before we go any further, I'd like to introduce everybody. I'm Hassan Argommandkhah. I'm the Clinical Director in Kirkby PCN.
Joe Ryan. I'm a patient under Dr. Maserani in Kirkby.
And are you a member of PPG?
I'm a member of the PPG.
I'm Alan Moore. I'm also from Dr. Maserani's patient group. I'm also from Kirkby.
I'm Mike Fegg. I'm from Roseheath Surgery and I'm also PPG member.
Lovely. So really today we want to talk about why do we have PPGs. Maybe we just check your understanding first and then we can delve into it a bit more to see why we are establishing PPGs, what's the benefit of the PPGs to the patients, what the practices would get out of it, what the patients get out of it. We want to tease a few of those things out. So who wants to go first?
Yeah, I don't mind. We had our first meeting yesterday for Roseheath and out of Halewood there, and it was quite interesting really. Everyone had really great ideas and tried to really talk through some of their experiences either from themselves and also the family. It's really to identify if, from a patient's point of view, is there any sort of subtle changes or anything that we can actually develop to try and help other members of the the community that may have difficulty either accessing the practice and the services that the practices offer.
Okay, and how about you?
I think when I first joined ours, I wasn't really sure what to expect, to be honest. Until you go to like 2 or 3 meetings, then you find out how it's going to work.
Finding your feet.
Yeah, finding your feet sort of thing. Before you actually, I didn't really say much at the first few meetings because I wasn't sure what to bring up and what would be allowed. You're allowed to say. But since then, I think you can more or less say what you want. Well, not what you want, but within reason.
Yeah, I mean, it's always important that when you're on a group like that, a participation group, is to be constructive because it's easy to criticize and come up with a list of problems. But what are the solutions? Because if you don't have solutions, the problems are just a list of negatives. How can we turn those negatives into positive? And I think that's where the PPG comes to itself,
Yeah.
Do you want to just...
For me, I joined up because I'm of a certain age. I've got a little bit more time on my hands. And I thought I'll go because these people out there, and I'm not clever by any means, but these people who can't articulate like themselves. And I thought, let's go and let's see what it's all about, and maybe we can ask certain questions. Since I've got a far better understanding of the way the practice actually works now and the constraints that they work under, i.e. especially financially. We all know the NHS is under threat in the way that it used to be. And everybody has something, whether they want to talk about mental health, dementia, carers. These are a host of things. But somewhere along the line, somebody has to make a clinical decision and say the funding goes there. So we're sort of trying to get that kind of understanding without being bombarded with a load of information that we don't really understand. We just want to feel as though everybody is pulling in the same direction. I'd just like to get a little bit more involved, or maybe be given, without being swamped with data and facts and figures, something more purposeful where we're not going to change the world, but I feel it's good that we have somebody.
But there's a chance to make small changes, isn't it?
Something, anything, and contribute and speak up for people who maybe can't
and
speak
not
up.
everybody's got a voice, have they?
No.
And you can bring your experience, your life experience to that scenario. Because I mean, you might be 65, 67, I don't know your exact ages, but you've got that many years of experience at work, growing up, the neighborhood, you understand the neighborhood probably better than the clinicians who might not live locally. So you understand what, for example, in your case, what Kirkby is about, you understand what Halewood's about, so knowing what's available, you can bring that to the meeting. Practice can also learn things from you. You can learn from the practice why they're doing certain changes. Nobody likes change. No. Everybody hates change. But if you know why the change is happening, once you understand it, you can be a bit more sympathetic and would support some of the changes. And then if some of the changes are not really productive, you can feed that back to the practice. Can't you?
Yeah.
Did that come through on your first meeting?
Yeah, it was really about, when we talked together, it was around everyone's experience of the practice and their expectations of what the practice needs to deliver. And it's really trying to find that common ground between making sure that what the practice actually says it's going to do and deliver, that patients feel as though they actually received that.
Yeah.
It was quite interesting, really, that there's parts of the community that unfortunately feel they're left out, or as you mentioned before, they haven't got a voice. Well, through my own personal circumstances, my own health, I want to pass that message out that there's a lot of help and support there that people just don't tap into.
And in terms of the commitments, you've been on a PPG a bit longer because yours was the first one yesterday. What sort of a commitment do you need to have to attend the PPG meetings and communicate with the PPG members and the practice?
We have our meeting once every 2 months for the actual practice.
So 6 a year.
We have a meeting amongst ourselves without the practice. Well, we try to. It's getting everyone together at the same time.
And do you do it in person or do you do it virtual?
No,
like
we do it in
person
or something. In person.
Yeah.
I think in person is better.
Yeah. I mean, if you're local, aren't you, really?
Yeah.
So, why not?
Yeah. Doesn't take as long to get there, so it's fine, But I think people just don't find the time to do it, to get involved in something like that.
How long are the general meetings, Joe?
It's about like an hour-ish, like Dr. Maserani, provides us, with a room, tea and, coffee, etc. And it's in, a nice, comfortable environment. If it's just us, we'll go and meet in a pub or a cafe, have some coffee. So it's about an hour, and we all sort of brainstorm.
And is it flexible, the timing, or you rigid with the timing?
I think it's flexible, but we try to stick to a time. But it's if people are in work, they're in work, and they can't get there for certain times, so you just have to accommodate them.
Yeah.
But anyone that isn't there, we'll send out a text or a WhatsApp and just
keep everybody in the loop.
And people phone each other and stuff like that.
Are you aware of what's something called super PPG? That's the wider PPG. That's in your PCN. For example, in your PCN there are 5 practices. In your PCN there are 7 practices, and these practices get their PPG members, a representative of their PPG members, and representative of the PCN, like the clinical director, like myself, the manager of the PCN, the administrator of the PCN, and the managers from each of those practices get together about shared learning. Have you had experience of that?
No. I haven't personally, no.
No, and I haven't either, but I think it's a brilliant idea because we could be asking the questions that Mike's group is going to ask, and we can say, well, look, we've already found that out. Let's try and work together. Can you have a look at that, and we'll ask about this, and then we can all pool the information together.
And it could be also a sounding board to see how other people are doing things different. No point reinventing the wheel, is there?
No.
What we talked about yesterday is maybe inviting one of the PPG members down to actually help us construct whether it be agenda or what point and at what level that we're actually going to be discussing, and what influences we can actually have at the time.
And you all live in the community, so you could be the link from the community via the PPG to the practice. And practice
And vice
should
versa,
also
yeah.
vice versa.
Yeah, yeah.
You utilize your expertise, your connections to get the message out there to the community.
Yeah.
Do you get involved with the communities where you live? Any of you?
I don't. No.
I
No.
try to. Yeah.
Like, not the community,
Yeah.
but I want to get involved more in like people who are maybe a little bit like marginalised, or
Yeah.
like some of the younger kids like coming through. Yeah, I wouldn't mind going out speaking like to younger kids and go, look, don't do what we've done. This is the route you're going down.
I mean, all the PCNs have got what's called social prescribers, and they have good links with the wider community groups. And I think PPGs could get involved, knowing them.
Yeah.
And the super PPG I was talking about, a representative from the those groups, the social prescribers usually attends those. So it gives an opportunity to engage that way as well.
So how do we find out about that, the super PPG?
Well, for Kirkby, I've shared an email with Joe before, so that Joe's going to email me and I'll connect to Kirkby. And the same with yourself, with the Rose Fees.
Right,
if you email me or Brian, we'll connect you to the West PCN.
Okay.
And if other PCNs are watching this podcast, because we are providing this to the whole of Knowsley, other PCNs have also got the wider PPGs, so that everybody, we want Knowsley community to come together to support each other and actually improve each other's health and in services, really. That's the key message here. So if we wanted to take a key message from the PPGs back and tell the audience out there why they should get involved with their PPGs if they've got the time, what would you say, starting with Joe?
Everybody hasn't got to be an expert in anything, and the more input from a different like angle, you haven't got to be like clever. I'm not clever. I'm working in like construction. Everybody's input is important, because you can't change anything if nobody's heard like your voice. So instead of like sitting back and like going, this is crap and I wish I'd have said this and I'm going to report this and that and the other, like go and try and like do something from the inside. That's what this is for.
Yeah. How about you?
Yeah, I would say if you can get involved.
Yeah.
And you will get some benefits from it. You'll learn how your practice works, and you'll know what constraints they're under, and that's why they can't do certain things.
I just want, from my own personal experience, I've suffered a stroke, and that I just wanted to, express to people that I actually meet that the service, certainly the care that I received was fantastic, and I want to get that message out there. There's a lot of support out there that's probably untapped by a lot of people.
And there's no age barrier to becoming a PPG member, is there?
No.
There's no gender barrier.
No, there's no barrier at all.
It's completely, and it's absolutely, apart from, giving your time for the benefit of your practice, which any improvement in the practice benefits you, really. It's your general practice, it's your GP practice. So if you help to shape the services they deliver the way you want it, then it would benefit you ultimately, wouldn't it?
Yeah.
Because you might be healthy now, or you might not have had a recent event of any sort, but going forward you might. And it'd be nice to know that you helped shape that service that's not looking after you, wouldn't it?
Yeah.
Yeah.
It was.
Yeah.
And leave something behind for the kids and the grandkids.
Yeah.
So about a year.
Like, for example, earlier on you was talking about mental health. It's important that you, for example, take that to PPGs to say what the practice is doing to provide better mental health care. You've had a stroke. What services are available post-stroke? In Kirkby, we're doing something around dementia. What services available for if people early detection of dementia, support during dementia, and when you get severe dementia with frailty, what's available in, for example, in Kirkby or whatever. Lovely.
Yeah.
Thank you very much for coming, guys, today.
Thanks very much.
Really
Thank you.
appreciate it.
Thank you.
Your input has been
Enjoyed
absolutely
it.
A star. Thank you.
Thank you.
Cheers, thanks.
Cheers.
Bye now.